Are you dealing with hip pinching pain, maybe when you're squatting or going into deep ranges of motion in your hip? Or maybe you're getting some clicking, catching that's painful as well? If so, you may be dealing with a hip labrum issue. But don't go running to your surgeon quite yet. Instead, let us help you understand what causes hip labrum issues and what you could do to take care of your hip health today. Hey Rehabbers, welcome back to the channel. My name is Dr. Adelle Smenner, and I'm so excited to have you here with me today to discuss everything there is to know about the hip labrum and some exercise concepts you can keep in mind if you're dealing with some hip issues yourself. So you may be asking yourself, what is the hip labrum exactly? Can't quite see it in the model, but it's similar to the shoulder, which also has a labrum. The hip labrum is a type of connective tissue known as fibrocartilage, which covers the outer portion of your hip socket. So deep to the muscles, but also right on the outside of that hip socket there, providing more stability and fluid movement throughout your hip joint. Unlike the shoulder though, the hip joint is inherently quite stable due to the depth of the hip joint compared to the shoulder joint that allows for better congruency of the two bones. However, it is also very mobile. Being a ball and socket joint means it can move in all planes of motion. So that means flexion, extension, abduction, adduction, internal and external rotation. In addition, the hip handles a large amount of our weight-bearing capacity, as well as transfers energy through our pelvis, core, and lower body. As a result of this large weight-bearing joint and energy transfer, the hip can become a culprit of various conditions, such as osteoarthritis, tendinopathies of your glutes, and what we are discussing today, hip labrum issues. Let's talk hip labrum injuries. Firstly, the labrum does tend to have a higher risk of injury in activities that place a lot of stress on the hip, especially with repetitive movements into deep squatting and or rotational movements such as competitive sports like football, dancing, and ice hockey. In addition, there is a correlation between hip impingement or FAI syndrome and labrum pathology. If you're unsure of what hip impingement is or want to learn more about it, be sure to click the link right there. The reason that some individuals with hip impingement may have injury to the hip labrum is because there is less availability for the hip to move into end ranges of motion, particularly hip flexion, so knee to chest, and internal rotation, which places more stress on the structures of the hip joint, with one of the biggest culprits being the hip labrum. If you're unsure if the hip labrum is the cause of your issues, you may feel that you can't squat as deep, raise your knee up to your chest, kind of like this, just like I showed, or get out of a chair, just to name a few examples. In addition, you may feel your pain in a C-shaped pattern right along the front of your hip with some associated clicking and popping. If even more progressive, the pain could refer down the front of your thigh to your knee, and weight bearing might even become difficult. So what can you do from an exercise perspective to help with your hip labrum pain? Let's head to the gym and I'll show you. All right, so let's get to work. I myself have been dealing with some hip discomfort as a result of some hip impingement, possible labral issues. So trust me when I say these exercises are key in improving your hip strength, stability, and mobility. So like we've talked about, the first thing we're going to work on is our mobility. We talked about how flexion and internal rotation are usually the more challenging positions when you're dealing with the hip labrum issue. So let's start off with improving our flexion. We are going to start off with a quadruped hip mobilization. So essentially, all you're going to need is a mobilization belt or even like a strong resistance band. You're going to loop yourself in, and you want that band to go as close to your hip joint as possible. And position yourself at an angle so the band is pulling in an inferior and posterior direction. So you're gonna wiggle your way forward, and that band should give you a nice traction as you sit back into a quadruped rock back position or a child's pose position. The key to getting a good stretch here is making sure you're fully relaxed. So if you're trying to fight it the whole time, you're not gonna feel a good stretch. So again, nice and close, sitting all the way back, reaching those arms forward and resting here. You can even sink into that side a little bit more to get a little bit of an extra stretch and get deeper into your hip flexion range. Alternatively, you could go laterally, meaning just side to side, so pulling out and perform the same movement, or do it in a tall kneeling or even on your back. But generally, I find that quadruped position is the best. All right, so we talked about flexion. Next up, let's go internal rotation. From here, we're gonna work on this 90-90 position. So this 90-90 position is easily my favorite to work on hip internal and external rotation, as well as just general hip mobility, because it works on these compounded end range movements. So as you see, I'm sitting here ideally in like a 90-degree position at both hips, and you're gonna wanna start with your pelvis flat on the mat. So if you notice that you're not able to keep both kind of sit bones down, that's where these yoga blocks can come into play. Prop them up right underneath. You can use one or two depending on what you have available, and hopefully you can get nice and upright there. So that's gonna be the priority, right? Your starting position. When you're there, right, whether you're on your yoga blocks or not, you're gonna sit nice and tall. This front leg's gonna be an external rotation. This front one, or this back one's gonna be an internal rotation. So because we're working ideally on internal rotation, we're gonna put an emphasis on this back leg and getting a deeper stretch here. So you might already feel a stretch right through the front of the hip. When I say stretch, I mean not like a muscle stretch. It might feel like a little bit deeper, maybe a little pinchy, but again, because we're working on joint mobility, it's gonna feel different than that muscle stretch that we're used to. So when you're here, hold up nice and tall, and then you're gonna reach to the back leg. So you're like right leg for me here. An example, deepening that stretch in internal rotation and back. So this is gonna be like the perfect one for starting out before your warm-ups or maybe before your lower body workouts, because we're working on dynamic mobility, moving in and out. But you could always hold it as well, turn it into a static stretch, possibly something for the end of your workouts or on a rest day. There's also tons and tons of variations where you can work on more dynamic, just going into flexion, external rotation, even working on a lift off if you can do it, and working on that internal rotation in a lot of different dynamic ways there. All right, so we got flexion and internal rotation mobility under control, right? Now let's work on stability of our hip. So as we talked about, our hip and our shoulder have a lot of similarities. One of them meaning that they're both like ball and socket joints. The other one, they both have a cuff. We're very used to hearing about like the rotator cuff of the shoulder, but what about the cuff at our hip? We actually do have a lot of deep hip rotator muscles that lie underneath the glutes that help stabilize your hip by kind of providing a compressive force of all of them working together. So what is one of the best exercises to work those muscles? A side plank. So essentially we all know a traditional side plank up like this, right? Making sure everything's nice and lined, but always feel free to add your own variations here. You can go into clam variations, right, to bias your glutes a little bit more. You can go into a clam with a thrust. You could go into a knee drive, right? You name it. All of those are gonna work not only your shoulder and your obliques, but those deep hip rotators that help stabilize your pelvis and your hip socket as well. All right, so we went over rotation, we went over flexion, we've gone over stability. Now we're gonna finish up with core. So your core might not be a traditional thing that we think about when it comes to hip rehab, but it should be a part of any hip rehab, whether it's labral, impingement, or even like a total hip. But obviously today we're focusing on labral issues. So when we're talking about core integration into your hip rehab, we always like to think of exercises that do challenge the core, but also integrate that into our hip movements as well. So one of our favorites for that is gonna be a bird dog. When you're in your bird dog position here, you're gonna reach your opposite arm and leg out nice and straight. All too often, we kind of see this arching motion at the back, our pelvis is dropping, we're rocking all over the place. In those scenarios, we're not actually working on our core. So focus on staying nice and steady, belly button drawn in, and isolating that motion into true hip extension rather than excessive lumbar extension. That's how we're integrating the core work into our hip, right? So we're gonna go there and back in. You can always alternate side to side to make it a little bit more challenging for your core, or my favorite variation is actually adding a resistance band to my hand and opposite foot to give extra resistance on the way out of the movement. And if that's still too easy, you can always incorporate something a little bit more functional like walking carries with weight at the gym. But remember, the moral of the story here is always, always, always integrate core workouts into your hip rehab. Okay, rehabbers, I hope that this video has helped you understand more about the hip labrum, how it may become injured, and some principles you can keep in mind when you're working on your hip health. If you find that you're starting to have an inability to bear weight through your hip with progressive symptoms of clicking, increased pain, especially at night, and/or decreased strength and motion, be sure to consult with an orthopedic specialist who focuses on treating hips. And remember, when going through hip rehab, focus on a healthy dose of hip flexion and internal rotation mobility exercises, strengthening the cuff of the hip, and functional progressions specific to your daily demands. If you'd like more guidance on how to rehab your hips, we would love to help you. Many individuals with hip issues, including hip labrum issues, have had great success with our hip rehab program, which takes you through a full step-by-step program designed by doctors of physical therapy, so you can get back to what you love on your own terms. Click the link here to learn more.
Hey, did you like this video? If you did, you should definitely check out the Prehab app. It includes all of our programs, a brand new workout library, and tons more videos like the one you saw today. Check it out by clicking on this link. You get a free trial. Take control of your health today.